Snoring, I kind of believe, is a ticking time bomb because it's something so innocent and something people don't even pay attention to, but it has such huge, profound impacts on the body.
We welcome you all to Talk the Talk. My name is Janine Steen.
And I'm Toni-Ann and Dr,
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. Hello and welcome everyone to this episode of Talk the Talk. Joining me today is a colleague and dear friend, Dr. Suraj Vatish, Clinical Director and one of Europe's leading providers of tongue and lip tie release procedures. Having performed thousands of successful treatments for babies, children, and adults, he is dedicated to helping families overcome feeding, speech, and airway challenges through safe, effective, and compassionate care. Suraj has undergone extensive surgical training in advanced phrenectomy techniques and is a respected clinical lecturer teaching clinicians across the UK and Europe on tongue tie assessment, surgical techniques, and post-procedure care. Today, we'll discuss his journey, his work in tongue and lip tie treatment, and the impact functional oral health can have on overall well-being. Thank you, Suraj, for joining me today.
Well, Toni-Ann, thank you for having me. And honestly, thanks for such a great introduction. You're a great friend as well, and I'm really honored to be here on this podcast with you today. So thanks for having me.
Yes, of course. I'm so happy to have you. For the listeners, we have known each other for a few years now. I don't know, how long has it been? Maybe
at least about 3 years.
Yeah, I was going to say 3 years as well. We did some conferences together where we were both speakers, and then we've even hosted conferences out by you together, which we'll go into because we have an exciting upcoming one, but love so much and appreciate having the ability to talk all this amazing tongue tie and dentistry and airway stuff together with you. And for most of my speakers and guests on the podcast, I love to start off with talking about your journey and what got you first into dentistry. How did your career kind of pivot into tongue ties? What does that look like for you?
Wow. I know it's how quickly time flies, Tony. And honestly, like when you say 3 years, we both say 3 years. I was thinking it was just yesterday we actually bumped into each other. I think it was Breathe to Thrive, wasn't it? Breathe and Thrive, not Breathe to Thrive. Breathe and Thrive conference.
Yeah, it was.
My story about dentistry. Now, I always found that I wanted to be in a profession that kind of like works with people. I love the art of surgery, and I found general medicine to be very scary. Let's put it this way. So I've always been someone my aspirations were to be a surgeon. So then I looked at dentistry and I thought, okay, I could go into the oral surgery aspect. So when I was in university, that's what I always although I was trained as a general dentist, I always had the interest in oral surgery and doing kind of those changes there. And that's where most of my career took me. I graduated in Valencia. I did my surgical residency in Madrid, worked in London as providing dental implants, wisdom teeth, all the kind of bloody stuff you think about. And then I tell the story that one of my colleagues told me about tongue ties. And I always remember the first time in Madrid when I did a tongue tie surgery with scissors. It bled a lot. And I was like, I'm never doing this procedure again. I swore off it. And I look back and I think of myself like that 7-10 years ago. Like I said, Suraj, how wrong you were. Because there was two things I swore I'd never do is treat babies and children and do tongue ties. And now look at me, Toni-Ann. Look.
And now look at you.
So it got life-changing when I took Dr. Baxter's course, Dr. Zagi's course, and then I started having my own spin on things as well, obviously. So when you do any course, it's always important to get your own kind of spin of how you do things, get comfortable in your way, and then tailor things to how you can help your patients.
Yeah, definitely. Yeah. And a lot of your training really needed to be over in the United States, right? Obviously, you're in the UK and London. And we've talked about this in the past that things are a little bit more behind in your area, correct?
Yes, unfortunately, in the UK and Europe, it's still a very emerging field. And we're very reliant on the States for our training.
Mhm.
So, and that's where we got together because we decided to try and bring some of this training across the pond a few years ago. But I would say slowly and steadily, our community is growing. It started off, I remember when Melissa first came and we tried to get all the practitioners in one room. There was only about five of us. And then over the years, when you started joining us as well, you saw that we're actually getting more and more people interested. We're getting more people asking the right questions. And the community is growing, albeit very slowly.
Mhm.
We're hoping to get more institutions to now start addressing and adopting tongue tie and adopting a holistic approach, because the danger we are seeing in a lot of places is it's becoming more about the actual procedure than actually looking at holistic care.
Definitely. And, we talk about that all the time, in that the release being just a part of the journey and just a piece of the puzzle, and that everything that we do before and after that tongue tie release is really where the positive outcomes come. Obviously, we wouldn't have been able to get them without the release. So that's really important too, but we got to work together there.
I agree with you, Toni-Ann. And when someone asks me, like, what is the method about this madness, but like doing a pre and post work, I tell them, and I said, with all the thousands of cases I've done it all the different ways you can imagine. I've used different materials. I've done with and without pre-op preparation, without post-op preparation. And all of this I can say to you is because I've made those mistakes. When someone's learning and I'm teaching them, I'm like, look, I'll tell you, unfortunately, we all learn from our mistakes, and I made those mistakes. But you have to at some point understand, instead of just accepting things, think, why is this happening? How can I make it better for my patients? And that's where the approach that we discussed, the whole holistic approach, has its results. Now, we always get worried about looking at randomized control trials, evidence, etc. But the one thing we forget is clinical evidence is still held in such high regard. And that's what we should be also looking at, is case studies, how, for example, you and I work together with some patients where you do the pre-op myo, the speech and language therapy, and then I'm doing the tongue tie release. We need to have that whole family approach, as we call it.
Yeah, it is all of that working together and having the education. I know as SLPs, we don't learn a lot about tongue ties and even about myofunctional therapy in our schooling. And it really is something that we have to seek training in ourselves, a specialization that is more elective. It's not required of us. Do you find the same thing on your end? Did you learn about tongue ties going through schooling? Was it something you had to really seek out?
Well, I remember in dental school, our tongue tie lecture was one slide showing what ankylosing is, and that's it. There
Okay.
was it was basically an anterior tongue tie. And they're like, this is a tongue tie, and that's it. There was no emphasis on the speech, the development. We touched a bit in orthodontics about mouth breathing, but at that point they were saying, oh, there's no evidence to say that mouth breathing affects how the face and jaws form. So whilst when we look at what we're taught in university, we're not taught much. We're taught a lot of other things, but we're also kind of taught that leave the body in isolation, which is something else that what I tell a lot of the students I lecture for is, you've got to break that mold of what you're taught and kind of look out and see your patients as a whole.
Yeah.
Because Toni-Ann, you and I both know that this patient who walks in isn't just a mouth or a tongue. If that was the case, all of our lives would be so much easier. They just remove their mouth and tongue and say, okay, Toni-Ann, you work on the tone. I'm going to go and have a coffee. Dr. Suraj, you take care of the tongue tie, fix the teeth while you're there, and then I'll come back and just pop it back in. But it's also connected, that we need to remind all our colleagues that everything is all linked up. And it seems that we might be saying something very simple and binary to the normal person, but actually sometimes, unfortunately, as healthcare professionals, we're not taught about this. And it's where you've got to also think common sense sometimes needs to slightly prevail.
Yep. We got to pull back those layers and realize that there is a whole human body in front of us, and their symptoms are unique to them. And we can't put everybody in these like black and white categories. We need to, we're clinicians, we're doctors. We need to evaluate, and we need to figure out what specifically is going on for this patient and how it can all be related. And I feel like, sometimes it's like, looking at a picture of a frenum and someone saying it's a tongue tie. And it's like, well, we got to look at function. We got to look at symptoms. Of course, we want to see what it looks like, but there's got to be that dynamic approach involved.
I agree. And it's because the tongue is such an important muscle and part of our body. It's not the fact of just like I tell a lot of people, bring it up and then all of a sudden your life's going to be different. I said, usually in adults or older children, they've grown up that way. So you've grown with that restriction. And the simplest way to understand it is treating a tongue tie without doing the working on the function is basically like you having one leg. I then give you two legs, and all of a sudden I'm like, go and run the marathon without actually properly learning how to walk and adapt it. And that's what and when I said to patients, like, that makes sense. I said, well, you'll get the odd ones, and there's always nothing's ever 100%, but you will get some people who, like you see those people who really push through, they compensate well, and they'll run a marathon with one leg. And I give myself as an example. I've got two legs. Yet ask me to run a marathon, I'll probably do 500 meters, and I'm gone.
Yeah, it is. Everyone compensates in different ways. And I think part of what we have to do as a specialist is figure out those compensations, because sometimes they're really good at making it seem like they have it all together and can do all these things. But I always say when we see compensation, that means there's dysfunction. So we need to, we don't want people compensating if they don't have to. A lot of the times when we see children with tongue ties, we see them doing things that we might teach a geriatric post-stroke patient to do, chin tuck to swallow, use a liquid to help the food get down. Those are things that we teach our elderly patients that have gone through something neurological like a stroke, yet our pediatric patients have just figured it out. They're like, hey, when I take a sip, it helps me swallow better. Or if I use my neck muscles, it helps me get the food down better, just because their healthy growing bodies have learned how to compensate just by figuring it out themselves.
I agree with you 100% there, Toni-Ann. And we have to look a bit deeper to even answer some of these questions sometimes, because as a human being or organism, survival is our main goal. And however we will try, our bodies will always want us to survive and kind of not show the effects that we're working too hard. Mm-hmm. And that's what I get a lot of kickback from some people thinking, well, I'm fine. I said, but unfortunately, like you said, you can swallow in a wrong pattern and never know what it's like, but that's your body's managing it, so it's great. But Imagine what it's like if you can actually use your body optimally, which is where the whole science of biohacking comes in now. But it's so easy for people to forget that just because we're up here, etc., we're doing everything. A lot of the times we're not moving optimally. We're not swallowing optimally. We're not even speaking optimally sometimes. Mm-hmm. But once we find out why, we'll begin to unlock a lot of deeper health.
Yep. And not sleeping optimally many times, right? And I find that with our, especially adult patients, they had this presentation for so long that is their normal. That's what they think, are you a good sleeper? Yeah, I sleep good. I sleep fine. Then we start treating them and they get to really see, and they're like, this is what I should have been sleeping like this whole time, or this is how I should be breathing, but they have nothing else to compare it to. So they think it's okay because they don't understand how much better it can be.
Exactly. And what you just said highlights another thing that I find is we put everything on metrics as well. Mm-hmm. We're too obsessed sometimes with measuring everything down to the core. When sometimes it's very simple, is like when we look at sleep, how do you feel in the mornings? Oh, I feel amazing. I've rested well. No, I need more sleep. That for me is the simplest way to find out if you're sleeping well or not. Because if you're sleeping well, it's a silly question. How do you sleep? Oh, I slept well. I didn't sleep well. Oh, I slept bad. There you go. You don't need to sometimes, obviously we like data. We like to think, okay, we're measuring, but sometimes just finding out how people are, especially with adults, like you said, you work on their sleep afterwards and they're already telling you like, okay, now my sleep's very different. Now I'm feeling more rested. Now I can actually deal with life's problems better than when they're compensating and not sleeping too well. So it's good to, like I said, you've done a really good job at explaining how important the qualitative part is rather than the quantitative.
Yeah, yeah. When you have patients, because I know now you're a practice where you do things outside of tongue ties. You're a whole, beautiful. I've had the privilege of coming over to London and seeing your, 3 stories of office. Tell a little bit about what you guys do as a whole practice.
So our aim is to treat every patient as a whole. So we have almost specialists in every area of number one dentistry. So we have orthodontists, we have root canal specialists, we have pediatric dentists. Obviously, can't forget the pediatricians. It's a mainly pediatric dental practice. And we also have myofunctional therapists and osteopaths as well. So we're trying to cover everything as best as possible. And a lot of the time, speech therapy, well, Toni-Ann, you're so good with what you do virtually. We do love sending patients to yourself. We also have a good local community around. But the idea is that we treat every patient as a whole. And we like to be connected with different specialities and different people to make sure that this patient is getting the best service. So that usually starts off with myself doing a consultation, asking the parents questions. Like one of them, the most important one I ask is, how's your child sleep? And a lot of the times I ask the parents, but I direct it towards the child. And the child usually is very easy to tell me, I need more sleep, or I don't sleep well. Then we talk about eating as well.
Yeah.
And like you said, the idea is our main goal is to be there and help the long-term health of our patients, because now what the research is coming out on, like you said, the effects of poor sleep and on the organism, on the cellular metabolism. So you're more likely to have diseases such as high blood pressure, diabetes, and cholesterol if you're snoring, number one. And also, let's put this from a social way, if you have a child with speech difficulties, you want to help that child more than anything, because you don't want him to have to struggle or her to struggle through school,
Right.
not being able to express themselves, not being able to communicate with their colleagues or their fellow school children. And we want to be in such a way that we're there to help them.
Yeah. What are some of the further questions that maybe you or your staff are trained to kind of ask parents and families to see if there are symptoms that could be related to tongue tie or symptoms that could be related to sleep disordered breathing? Do you have like specific questions you are often asking about?
Very good question there, Toni-Ann. Now, we always ask how, number one, breastfeeding was as an infant. Did they suffer colic, reflux? Was breastfeeding a good experience, or was it something that was it cut short for any reason? That's always another good way to kind of find out. Now, when we then look at the other parts, is we look at how the child then transitioned in solids. Was that an easy journey? Was it a more complex journey? Currently, are they a very picky eater? If so, what do they prefer? Do they prefer very soft, mushy textures? And another question I like to find is, when they eat, are they like a vacuum cleaner? So they just literally shove the food in their mouth and swallow it, or are they actually chewing their food? Because all these kind of breadcrumbs, we say, will help us build a diagnosis. And the most important thing is what we have to also do is look directly at our patients as well. How's their posture? How are they walking in the room? Do they have dark circles under their eyes? Are they able to kind of hold a conversation with you? Or are they very jittery? Or what's their attention like as well? And the last thing I always ask is, has anyone ever told you it's difficult to understand your child or when they speak? And that's usually quite a good indicator, because that gives the usually parents thinking, actually, even with when you get like a 7-8-year-old, they say, oh yeah, my child had speech therapy for a lot of years, and now he or she is doing really well. But if they get very tired, they regress back into their old patterns. And that for me is already like, okay, we need to have a look and see what's happening there.
Yeah, because it shows it really hasn't generally generalized or habituated, and they can only do it when they're really focused or have their full energy. Yet when they're tired or really excited or feeling angry and frustrated, then it's all out the door. And that's because, we haven't really gotten to the full underlying cause or reason why they were having that trouble in the first place. We see that all the time with patients.
I agree. And it's one of the most underlooked things, and it's where my other speech and language therapists and yourself, I think, appreciate as being a dentist, this is not usually as part of our training. This is something that
Right.
I've learned by spending time with you, by spending time with some other speech and language therapists as well. And it's good that I have your support to then send this patient to for further evaluation and work.
Yeah, definitely. You have to have that collaboration and have that team around you. And I know things are advancing and changing so much in your area, even your own practice expanding, right? You're in multiple locations at this point now.
Yes, it started off, and I think when you came, we were just managing to get a bit bigger, but it was literally me doing tongue ties in one surgery space. And then as we started to grow, we started to take over more space. We got myofunctional therapists in-house. I started to bring the osteopaths in as well. And now we're quite lucky to say we have one key center. We have a couple of outreach posts, and thank goodness we are still growing as well. So we're very excited about that.
That's awesome. And now, some of the questions that you mentioned you ask and are part of your initial consult or check-in appointments that your pediatric dentist may do. Is that something that you find happen if you're at any pediatric dentist? Because I know some parents may think like, yeah, we see the dentist, every 6 months we go to the pediatric dentist, but they never ask me about their sleep or their diet or speech. So do you find that that's not something every pediatric dentist does, or do you feel that that is more common practice?
Well, it's a very political question there, Toni-Ann.
Yeah.
I wish it would be very, very common practice, because pediatric dentists have that advantage a bit. You kind of see a pediatric dentist more than you see your pediatrician, and more than you see and your general practitioner as well. You see them so much.
Yeah.
So the first pediatric appointment, or the first time a child comes to see a pediatric dentist appointment, these are the questions that should be asked. And throughout the times when we have, I think you have the same mistakes, we call the hygiene recall. Although it's quite a quick appointment, but having questionnaires, getting these questions out to your patients is a great way to kind of start building up awareness, because a lot of the times life is very busy.
Yeah.
Children will just go through life and we won't even know, because, okay, we've got the school run, we've got, like we'd say, I'm going to use an American term for your crowd, like baseball practice or soccer practice here.
You got it, Suraj. Good job.
It's, I think the time I've been spending over the States, I'm kind of changing my analogies as well. Like, here's a funny story. I don't say nappy anymore, which is the English word. I say diaper. And that's where everyone's like, looks at me like, where did that come from?
That's great.
So as parents are so busy, etc., it is so good to find a pediatric dentist. And I wish it forms part of the standard questions you ask, just to kind of get more information and be there earlier to pick up these issues. Because unfortunately, when we get to adults, we're already far too late.
Yeah.
And an adult who snores, has sleep apnea, is on a CPAP at some point, was a child with sleep disordered breathing.
Yep.
And this is what we want to kind of come in and do our best so this child does not become that adult. So that's where in our practice, our pediatric dentists do ask these questions, even if it's just throughout a checkup, just to make sure everything's okay. And they do have the Fairer scale. So they just have a look and see if there's anything that they need to flag up as well, or send over to me or the SLT team or the Maya team as well.
Yeah. And I love that you talked about that, it's a scale, right? And a mouth breathing child that's snoring is likely a future adult with sleep apnea. And I find that sometimes when I'm doing my evaluations, most patients that come to me, they're not always coming for myofunctional therapy, but it falls into a myofunctional evaluation because of the symptoms that they're disclosing to us. So a lot of the times I have to kind of educate families on things that I'm seeing that might not be, so obvious to why this child's having trouble with an R sound, but is very much related. So one of those, when you bring up about a parent and an adult with sleep apnea, and sometimes the parent will say well, I snore, or his dad snores and he's fine. And it's like, well, are we going to take this time to dig a little deeper right now and really find out if he's fine? Or, I'm educating on the fact that your child mouth breathing and snoring could potentially be, why this dad in front of me is tired throughout the day, has temporomandibular joint dysfunction, has, daytime fatigue and, on caffeine throughout the day to just survive throughout that day. And it's so related. What we see as children is so much less, but if we don't fix it, that's where it's going.
You're 100% right there. And the issue we do have is snoring has become something very normal and acceptable, and same with mouth breathing.
Yeah.
And I tell parents straight out, and some people, whether they like to hear it or not, I said, look, it's not an insult to you if to say you snore. I said, snoring, I kind of believe, is a ticking time bomb, because it's something so innocent and something so people don't even pay attention to, but it has such huge, profound impacts on the body.
Mm-hmm.
Now, the way I say it to someone is, when you're snoring, the flow of air in the body's interrupted, and it has different effects. Now, we've got to think how sensitive our body is to oxygen. We know from first aid, if we have more than 3 minutes of a loss of oxygen to the body, we start to get brain damage. Now, when we snore, we're having micro events that are stopping the blood flow going around the body as well, because we're not breathing as efficiently. Yeah. So these events can, in some cases, in the severe cases, they're called apneas, and that's where we stop breathing while sleeping. And unfortunately, adults, we can compensate through lack of sleep a lot better than children, because at that point, our brains are kind of formed. But imagine that you're a child and you're not getting the right amount of oxygen going into the body. How is that going to affect how you develop, how your brain develops as well? So when we sleep, our brain develops new neuronal connections. It's going to be a lot harder. Mm-hmm. And this is what I kind of stress to parents to say, if a child's snoring, never ignore it. Unfortunately, it's not cute. It's not fun. You do not want that child to develop to be an adult that way. And if you're an adult that's snoring, definitely let's get it looked at, because everybody is now looking at maximizing their longevity, maximizing their health. And whilst nothing is ever 100%, and I'm very transparent about that, there's no harm in breathing better. Yeah. It's only going to help you long term. You might not feel those differences, but your cells in your body will thank you once you're breathing better as well.
Yeah. And there's so many professionals that are, screaming from the mountaintops that sleep should be quiet. Snoring might be common, but it's not normal. And we just have to keep reiterating that, because it is natural that you think like, oh, so-and-so snores too. He snores. Oh, she said her son snores. And you think because a lot of people do it, that it's no harm. It's, common, but it's not normal. And it is a sign of dysfunction. And there are things, those are red flags that we need to start working on stuff.
Precisely. You said it very well there, Toni-Ann.
So I'd love to, as I have right here, talk about this.
Well, you were one of the inspirations for the book as well. You and Janine and honestly were a big inspiration for me to write the book as well. So I love to see that you got a copy there.
I do, right here, Untied to Thrive. Can you tell us a little bit about, obviously, what brought you to, write a book and what's in this book, and maybe people, want to go and purchase that? What can they look forward to kind of reading and learning about within that?
So the idea about the book was just to give parents a small guide. I wanted to keep the language very simple. When people ask who's your audience when you're writing to, I'm writing to those parents out there who comes from a personal story, who was like my mother. Yeah. Now, as a child, I mouth breathed a lot. My mother went around asking questions. All the doctors told her it was normal. She then found out I had enlarged tonsils. My grandmother, who was a GP, told her not to get them removed because tonsils are very important for her immune response. And there were so many things that she thought about, which, had she had the information in this book, she could have made a different decision. Wow. And this all culminated to a point when I was about 13 years old. And I still remember to the day we went to the orthodontist's office and he said to me, you need 4 premolars removed. And then my mother said to the orthodontist, is there no way you can expand the jaws? And I still remember the laugh he gave. It's like, it's etched in my memory, because he was like, that's not how things work.
Oh my God.
And at that time, it was the norm to, all children had premolars removed at that point and had braces. But my mother was so ahead of her time. And if she had the information there, she would have made a different decision, because as you know, Tony, I'm being a parent. Children, we don't really know what to say, but parents have that responsibility. And a lot of parents are out there looking for questions and are looking for answers and have the
Yeah.
questions. And that's what inspired me to write the book. As I said, I've spoken to everyone I can, and like this podcast is great as well, because this really works to inform people. And by having the conversations and writing them down, this is a way that someone can read it. They have it all to reference to. And then you can take it to that dentist who's asking, who's getting ready to remove your 13-year-old's teeth and thinking, okay, let's remove these 4 premolars. You read the book, you might think, oh, wait, there's other ways to kind of go around and treat these things, rather than just taking one person's advice for granted. Because a lot of the time, I hate to say it, I respect all health professionals. We always accept their diagnosis, but sometimes if something doesn't feel right, ask the questions, look around, get a second opinion, find something that resonates with you. Now, if it resonates with you at that point to remove 4 teeth, fine. As a parent, that I'll say to you, that's your prerogative. But if you have the information, there are other ways now, which I tell everyone of, we need to put the information out there. And that's where this book came to my mind.
I love that. I didn't know that behind the book in terms of like using your mom as that inspiration. That's such a nice story. And, I think it also highlights that maternal, and it could be the dads too, but that parental gut instinct, right? We talk about that all the time, that so many times you as a parent, as a mother, as a father, you feel something just doesn't feel right. The dentist said the teeth grinding was okay, but something about it, just doesn't seem right to me. Or that the pediatrician said the snoring, he'd outgrow it. And that just didn't feel right to me. I needed to ask more questions and dig deeper. And it is just a perfect example of how powerful parent and parental gut instinct can really be for supporting your children and advocating for your children.
Exactly. And I also say, Tony, and the mother's instinct is more accurate than any medical test that we have out there. Whether or not people agree with it or not, a mother will know if something's wrong with her baby, and she will be more accurate than any other doctor or anything. So I do tell the mothers, if you have even one bit of a gut feeling, act on it.
Yeah.
Get another opinion, open every door, knock down every other obstacle, and turn over every other rock till you get the right answers.
Yeah, I couldn't agree more. And I'm sure you experience this as well. But when you say it and a parent, you see their eyes light up and they're like, I knew it. I knew it. I knew it. Something was telling me this. I'm so happy I found you. I'm so happy I'm here, because they just had that feeling this whole time.
I agree. And it's such a nice feeling sometimes, because a lot of these parents just haven't been heard.
Yeah.
And
exactly.
A lot of the times I get mothers and fathers in the consultation, especially that they've been told by so many other professionals that there's nothing wrong, but their gut feeling's been pushing them to see me. And then they see me and they unfortunately break down because of all these emotions that come through.
Yeah.
And it's so nice to be there for a family in this moment, because in some ways, look, you give them that validation that their gut feeling was right. Yes. And we know how to help their child and move things forward. So it's very rewarding when we do get to that side of things. So
as the SLP, I feel like we're even sometimes even more fortunate in the sense that we get to see them, frequently throughout this journey. Whereas like, they're before and you get to do the procedure, which is obviously such an important part. And then, you might see them 6 months later. So you're like, whoa, so much has changed. And we're kind of seeing them more gradually, which is just interesting and funny to see how like our perspectives might be a little different, seeing them on a regular basis compared to seeing them, once everything heals well and, they're back in maybe for a hygiene follow up, and you get to then find out how much has changed for them.
Yes, exactly. And it's quite rewarding, I think, from both sides that we do have our parameters that we see. And I think from one of the most rewarding cases I had was a child who almost was really struggling to speak. And the words I remember were, I have difficulty speaking fast because I kind of think faster than I can speak.
Yeah.
And then after all the work we did with her, I still remember I said, so how are you finding things now? She goes, Now I can think at the same speed that I speak. And then mom
Aw.
could stop laughing. And I said, this is where the SLT called me up and they were so happy. They said, we were struggling so much and we made this huge difference. And
That's
it just
amazing.
emphasizes that like how nice it is to work in a team and get all these great results, you know?
Yeah, yeah. And these stories are not, few and far. They're all day, every day. We're seeing these great changes for our patients when we have the right collaborative care, which is so important. And you and I know that. And we spend a lot of our time outside of our patient time, being at conferences, attending them, lecturing, and support Spot Pal. And, we utilize that a lot with our tongue thrusts and tongue tie patients, and just trying to help patients figure out how to support themselves outside of the therapy sessions, because that is where all the magic really happens. We want to get this to become muscle memory. We want that neuromuscular reeducation, and we need to empower families to be able to do the things that we're doing in session, outside of session as well.
I agree with you. And I know firsthand, Spot Pal is one of my favorite devices, if not my favorite. Okay. Let's put it this way. Not just because you're here, Toni-Ann. It is one of those things that has really. Well, I tell everyone all the time. I said there's few devices that I can say actually revolutionized our practice, and Spot Pal was one of them. My therapist, who was so apprehensive when I first told her about it, I said, just give it a chance. And now she swears by it. Like, she wishes, I don't think she has enough patience now, because everyone's getting a Spot Pal now. So she's like, I don't think if you ever went out of business, she would know what to do, because she's so used to it, which God forbid never ever happens.
No, definitely not. But yeah, it's, was created clinically, obviously, to complement and support. And we see it ourselves and have started the whole educational certification platform and series, because we know that it can just make treatment more successful, easier. Like, who doesn't want to have a little easier treatment, easier on the therapist, but easier on the patients too, and giving them that little, support outside of the treatment room. So yeah, it is really wonderful and inspiring to hear everybody else's experiences with it as we continue to grow and, get more and more patients in it as well.
I agree. And I wish Spot Pal all the best.
Yeah, Dr. Suraj, you were the first release provider that ever did a tongue tie release while wearing Spot Pal. And we were, lucky enough to have been able to be in London and see that happen live. And that has, supported the product even more, because now we have other release providers that are utilizing it during their release, which, is so supportive in getting that lingual palatal suction and getting that tongue elevated during the release.
You know what? It was such a pleasure for me to be able to use it, because it actually filled, in the clinical part, a big problem we have is when you numb a tongue and you tell the patient, put your tongue up to the spot, they're always lost. But if you give them a bit more there, they're like, I like that. And some of the time, I can't feel anything. But if you have that tactile sensation, even when the tongue's numb, it more or less finds the place there. And it's a lot easier for clinicians as well when you're checking the mobility during a release and afterwards. It's a great reference point. And it's something that, look, we now, like I said, my therapist is in love with Spot Pal. I'm even getting most of my patients when we do the release to kind of bring it whenever they remember, let's put it this way, to wear their Spot Pal for the release. I think I need to probably change my paperwork and say it's compulsory because it's great for everyone. And even afterwards, the neuromuscular training is just on another level. You won't find many devices that do that.
Yeah, well, thank you for that idea of wearing it during a release, because that definitely changed things a lot. So we love that, and thank you for that. I know we don't have all that much time left, so before we conclude and finish up this episode, I would love for us to take a second to talk about the October conference. So just a little backstory. We have been going to London, at least I have been attending for the last 2 years. And we were doing a conference, like you kind of said, it started off a little bit smaller and it has grown just from year to year. We used to call it Across the Pond. And we used to do it in June. And now this year you have really, really ramped it up. And tell us a little bit about what we got going on and what you are, turning this into a much larger conference now.
Well, Toni-Ann, firstly, thanks for all the support over these last few years as well. You've been Tongue to Toes is also part of your baby as well. So
Yeah.
our idea was, when we looked at, for example, the courses we were doing together, we wanted to give delegates something tangible. And now with how everything is growing and the awareness coming down there, we wanted to basically appeal to everyone, whether you're a lactation consultant, IBCLC, midwife, SLT, myotherapist, dentist, doctor, pediatrician, ENT. We want to appeal to everyone to basically create a standard of assessing tongue ties and understanding their effects. Because in the end, tongue tie is a multidisciplinary treatment. But it's always important that we all kind of sit down and we see the effects from infancy into toddlerhood, childhood, adulthood. We have brought together Toni-Ann, who is one of the best SLTs around in the world. She's coming all the way across the UK to talk about how she treats patients. We've got Melissa Mugno, a well-known myofunctional therapist, probably one of the best in the world as well. We have two pediatricians, Dr. Justin Roche and Dr. Eric Galindo. We have a professor of sleep, Dr. Vic Veer, who's a consultant ear, nose, throat doctor. And to top it off, we have a lot of virtual speakers as well.
Yeah.
So you will, as an attendee, get access to a lot of pre-recorded talks. And the main aim is to give you all the information so that when you see a patient in your practice, you kind of know what's right, what's wrong, see the signs of dysfunction, and just kind of to give you those missing classes in SLT school, dental school, medical school that you didn't have about tongue and lip ties, to then be like, is this the missing piece in my practice?
Yeah.
So that's how Tongue to Toes grew. And we're really hoping to see Toni-Ann again. It's really good when she comes over. And then in the end, the idea is we all get together, we all discuss, and we all try and help our patients' lives further.
Yeah, this is one of my favorite conferences. We now had gone from a one-day event. Now it is a full pack 2-day event, which is really exciting. So many speakers have been added. I know initially Spot Pal used to be the sole exhibitor or sponsor. Now you have multiple sponsors looking to get involved in this conference. So you really have grown it and been able to make it what this year event is going to be, which is wonderful.
Well, thank you to Toni-Ann, and thanks for all your involvement throughout the years as well.
Yes, I'm so excited. October, do you want to just give a little website shout out? So if anyone listening wants to join the conference and join us.
So for anyone out there, the website is www.tongue, T-O-N-G-U-E, toes.com. So on there, you can find all the information of all the speakers, what we'll be covering through the event, and how you can register. And we look forward to seeing you there. And Toni-Ann will be there as well to keep your spirits up throughout the course as well.
Yes, I can't wait. You can also follow Tongue to Toes on Instagram. We're putting some posts there, but definitely check it out if you are in this space and a professional. This is something that you won't want to miss. And if you're from the States like me, I mean, any excuse to go over to London is always appreciated. I never mind coming over there and seeing how things are going. It's a beautiful place to be. And again, thank you, Suraj, so much for hosting this conference, for being on this episode of Talk the Talk, sharing your expertise and knowledge. We are so grateful to have you as a colleague and, like we already said, a very dear friend.
Thank you as well, Toni-Ann, for having me. You're a dear friend of mine as well. I can't wait till October because we do miss you over here in the UK. So October can come soon. And if anyone in the States is thinking about it, look, you will really like London, and there's a lot of fun things we have planned. So we look forward to seeing you all soon. And thanks again, Toni-Ann, for having me.
Yeah, thank you. Thank you, everybody, for listening. Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.